Good morning. So we'll be presenting a case of a child with Down syndrome. Meet Liz. She's a 6-year-old girl with Down syndrome who was born 8 weeks premature and underwent heart surgery at 5 months. She lives in an upstairs apartment with her 3-year-old sister and mom. Her mom expresses concerns that Liz has been frequently falling, has difficulty with stairs, and poor endurance. She's also unable to keep up with her 3-year-old sister. Liz received early intervention services from infant to 18 months. She attended she attended preschool with other kids with similar disabilities at her local public school at 3 years old, where she received speech therapy, physical therapy, and occupational therapy. Now she attends general educational kindergarten 5 hours a day with special education instructor for 2 of the 5 hours, and the last 2 hours of the school day, she's in self-contained special education classroom. Liz is able to walk and climb on and off furniture. She can run for short distance when playing. She falls when increasing running speed or running for more than 25 yards. Her fall frequency increases with increased distractions. She presents with hypotonia, global hypermobility, and has abnormal gait pattern. Liz requires close supervision, assistance, and extra time on the stairs. So based on the information provided in the case, here's a list of additional questions we would like to ask Liz's parents. First, we would like to know if Liz has any residual problems after the heart surgery that may have an impact on her physical activity now. Is she taking any medications? Is her hearing or vision impaired? Has there been any sensory testing done to assess her proprioception and vestibular input? And did Liz have an orthopedic consultation for atlantoaxial instability? We would continue by asking if she has been assessed for intellectual disability, as that may have an impact on the intervention chosen by the physical therapist. Has she ever been tested for or diagnosed with ADHD? We would also like to know if anything has changed at school or at home around the time that they noticed Liz's falling stairs and endurance problems. And when exactly did they notice when Liz started falling? And what's the general setup of the house?
If we were the treating physical therapist on Liz's case, there are several assessments and standardized tests that we would like to know about her functional status. To begin with, we would perform the Brunick's Oseretsky test of motor proficiency 2, otherwise known as the BOT2. The purpose of this is to provide a comprehensive overview of fine and gross motor skills in children and young adults within school age range, up to 21 years of age. It covers areas of vestibular and non-vestibular balance, coordination, dexterity, functional mobility, gait, strength, and upper extremity function. This is an effective standardized test to use for Liz because the administrator can select the most relevant and useful forms to determine diagnoses and eligibility for services. Next, we will perform the sensory profile 2. This assessment will provide further information on Liz's sensory processing patterns. The profile includes various categories, including general, auditory, visual, tactile, vestibular, and oral processing. The sensory profile identifies and documents how sensory processing may be contributing to or interfering with the child's participation at home, school, and in the community. Based on this information, we as the PTs can develop effective treatment plans, interventions, and everyday remediations strategies. Next, we would perform the Pediatric Evaluation of Disability Inventory, or the PD. The PD assesses functional skills, level of independence, and the extent of modifications required to perform functional activities in young children. It measures functional status in the domains of self-care, mobility, and social functions across 3 measurement scales, including functional skills, caregiver assistance, and modifications. Next, we would perform the school functional assessment. This assessment evaluates and monitors a student's participation, support needs, and performance of functional, non-academic tasks and activities that affect academic and social aspect of school environment. It also provides justification of in-school therapeutic intervention. Lastly, we would perform the goal attainment scale, This assessment is an individualized outcome measure involving goal selection and goal scaling that is standardized in order to calculate the extent to which a patient's goals are met. We will be using this method to determine Liz's success in achieving the goals we set with her family. These can also be rearranged in order of priority.
For Liz, there are three options available for physical therapy. The first and most likely would be in-school PT, which she would be provided under the IDEA system. These services are going to be the most convenient for Liz and her family. The second option would be to have a physical therapist come to her home and do home therapy. One positive with this service would be access to the real life obstacles that Liz struggles with for practice and working on. The last option would be a classic outpatient setting. And while this may be less convenient for Liz and her family, a positive is that outpatient clinics typically have more equipment than in-school or home therapy. We came up with two goals for Liz, and both of them we had about a 6-month time frame in mind because that would be right about summer break when she'll be home a lot of the time. Our first goal is that Liz will be able to safely navigate the stairs in her apartment complex at an appropriate pace without assistance or stopping to rest. We will achieve this by working on improving her overall motor control and coordination. Both the Bruining-Sazaretsky and the goal attainment scale can be used to track her progress. And our second goal is to improve Liz's endurance so she's able to walk 100 meters without stopping. And due to her age, we will incorporate games and mini circuit obstacle course style interventions to keep her interest and attention. We plan to use the 2-minute walk test to monitor her improvement in endurance.
So there are a number of factors to be considered as we plan our intervention strategy. These are environment, foot clearance, lower extremity strength and endurance, and balance and coordination. Liz is easily distracted by audiovisual stimuli, and she often falls when she encounters higher levels of those kinds of stimuli. So to counter this, we will work with her in an environment that is familiar to her so that new environmental stimuli does not become an additional barrier to her participation. She has global hypotonia, which is likely diminished strength of her hip flexors, knee flexors, and ankle dorsiflexors, all of which contribute to decreased foot clearance during movement. And without that foot clearance, Liz is much more likely to fall, and participation in the kinds of endurance activities we want her to be doing will be challenging for her. And she may struggle with static and dynamic balance and have decreased motor control, especially during single leg weight bearing. So balance and coordination will be considered as we plan our interventions. We can introduce animal or monster walks, which are my favorite part of the intervention plan. And one of the reasons why we like these is because they are easy to modify and they can be done anywhere. So to improve lower extremity isometric strength, we could do monster walks in a sustained squat position. To target something like lower extremity eccentric strength, we might hop like a sneaky frog who has to land very carefully on the lily pad so it doesn't sink. To focus on motor control in single leg weight bearing, we may walk like a leopard, sneaking up on the antelope. So the slower Liz can sneak, the more time she spends in single leg stance. Or to target specific muscle groups or gait speed or strength in a particular range of motion, we might introduce something like a silly walk of the day, where we put together a specific series of movements that Liz can learn one at a time and that we can do with her. Another activity we might introduce is something like red light, green light, or we're calling it Don't Wake the Sleeping Dragon. It can involve speed, but it doesn't have to. What we're really targeting here is balance during the freeze and motor control during initiation and termination of movement. Again, these are games that can be easily modified to target gait training or to target functional deficits. And any version of these games are really facilitating Liz's full body participation. And that's something that we really want to see with her. And finally, we might introduce hula hoop hopscotch or travel through space portals. Of course, before we introduce higher impact jumping, we want to ensure that Liz has appropriately supportive footwear, especially because she does have that global hypermobility. But as long as we can do it safely, we do want to introduce things like jumping to promote her bone health. A game like hopscotch, like you see here, can target lower extremity strength in weight bearing, endurance, motor control, and coordination. And with these same hoops, we can make instant space portals just by turning them on their side and having Liz crawl through. Everybody knows that space portals can take you to all kinds of fabulous places, which means that Liz can not only actively participate physically, but she can participate in the creation of whatever world we're adventuring through today.
To help Liz achieve her goals, we will prescribe a home exercise program incorporating and modifying some of the interventions to fit her home environment. Liz's sister can join her in any of these activities and games. Liz can do the monster walks around her house using small stuffed animals or soft toys placed around the room to step over without knocking them down. Liz can also count to 3 alligators while balancing on the weight-bearing limb before taking each step. When doing balance activities, we advise her mom to be nearby for safety. Liz can also take a balloon and see how long she can keep it up in the air with only using her feet and lower extremities to touch the balloon. Additionally, Liz and her sister can create a hopscotch court with chalk to play outside. They can also use the chalk to create a pond with lily pads. They can be tasked with a challenge to return a lost frog or toy to its family on the other side of the pond. But to cross the pond, they have to hop from lily pad to lily pad. They can compete to be the sneakiest frog by seeing who can land the quietest so not to wake the sleeping fish. Liz can also practice climbing the stairs at home with her mom nearby for safety. A toy can be placed at the top of the stairs that she has to save from the evil king, and so she has to ascend and descend the stairs successfully to complete her task. Development of these skills will improve Liz's ability to perform activities for a longer duration by reducing the energy demands of the tasks, which will help to improve her endurance. Additionally, Liz can work on her endurance by performing a few of these activities back to back or performing one activity for an extended period of time. Liz's mom should encourage her to do as much as she can, but when she is tired, she should rest. If Liz does not verbally say she's tired, but her quality of movement is declining and she's having difficulty performing the activity, then she needs to rest. We would advise Liz's mom to encourage her to engage in various recreational activities. However, it's important to find activities that are low risk for extreme strain on her neck. Finding what Liz is interested in is of the utmost importance to promote maintaining physical activity and participation in social activities as she gets older. So we will provide her mom with several options and resources for Liz to try. First, we have Unified Sports, which is a program that combines athletes with and without disabilities on sports teams for training and competition. This would be a great organization for Liz to get involved with if her school offers it, because it allows her to engage in different sports activities with a diverse group of individuals. Weightlifting is a great activity for children with Down syndrome. We are providing a link for the YMCA as this organization would give Liz and the family access to a gym, swimming pool, and many other beneficial programs. We are also providing the link to Oak Hill Adaptive Sports and Fitness that provides services for those with and without disability, with access to a gym that has adaptive equipment, has trainers that are certified to work with individuals with disabilities, and it offers sports programs and clinics. If Liz is interested in swimming or pool walking, she can do this at the YMCA or through Sensational Swim School, which is a national organization that provides lessons for kids of all ages and abilities. Biking is another great activity for children with Down syndrome. I Can Shine is an organization that provides biking, swimming, and dance programs for individuals with disabilities. However, as of now, the bike program is the only one offered locally. If Liz expresses interest in biking, investment in the Strider Bike Balance would be a good idea because this one has often been used with children with Down syndrome. Dancing is a great activity for Liz to try. United Dance is a dance program specifically designed for individuals with Down syndrome with a specialized curriculum that addresses social, emotional, physical, and artistic growth. However, the closest locations for this program are Boston and New York City, but if Liz is interested, this is an excellent opportunity. Martial arts is another activity great for individuals with Down syndrome. Liz can participate in this at the YMCA, or one other local option is +1 Defense Systems. Lastly, yoga is a great activity for Liz to try. This link provided has directions and guidance through beginner poses for Liz to try out and see how she likes it. All of these recreational activities are opportunities that will not only help Liz's overall health and social well-being, but will continue to help her to develop her strength, endurance, coordination, and balance. And so we strongly encourage Liz to find what she's interested in and get involved.
Based on Liz's disabilities and overall condition, assistive technologies or mobility aids may be beneficial to her in some aspects more than others. In terms of Liz's communication abilities, there is currently no indication that she would need assistive technology in this domain at this time. In terms of physical mobility, Liz has a pes planus foot structure, as well as difficulty with increasing her running speed and walking greater distances. So an arch support within her shoes or a pair of well-cushioned athletic shoes may be beneficial in improving community mobility once Liz reaches that point in her physical therapy treatment. Liz requires close supervision, assistance, and extra time to manage the steep, open back stairs at her apartment complex. Environmental modifications, such as bilateral handrails along the stairs, could be installed to make stair ascent and descent less difficult. Anti-slip mats or grab bars could also be positioned in the bathroom to reduce any fall risk. Lastly, Liz's difficulty with audio and visual cues may be better managed and treated via training or medication rather than an assistive technology or mobility aid. To address any vestibular, auditory, or visual specific sensory processing issues, consultation with an audiologist, otolaryngologist, vestibular rehab therapist, ear, nose, throat specialist, ophthalmologist, or neuro-ophthalmologist may be helpful. Consultation with an occupational therapist can help Liz manage activities of her daily routine while living with proprioceptive dysfunction. To address any attentional issues, consultation with a psychologist, child adolescent psychiatrist, or cognitive behavioral therapist would be beneficial as well. An orthopedic screening performed yearly by an orthopedist or physician would also be necessary in assessing for possible atlantoaxial instability. And these are our references.